So I'm just going to talk you through how to use incentive spirometry. Incentive spirometry is a form of lung volume expansion that's used by respiratory therapists in order to increase lung volumes. It can be used for a variety of patients, including patients that have just had thoracic or abdominal surgery, as well as patients that are immobile. And so incentive spirometry is always a good option for those patients. It helps to prevent atelectasis. So each person, based on their height, their age, and their gender, will receive a different goal. They have to try to get at least 1/3 of the normal predicted in order for incentive spirometry to be an adequate therapy option for these patients. And so we can use a respirometer to check the tidal volumes as well as the inspirational capacity of these patients to see if they are a good candidate for this type of therapy. Now, if you do have a patient that's having issues with pain, especially after surgery, one good option would be to talk to nursing staff and request that pain medication be given prior to treatment. Another good option would be to encourage your patient to use pillow splinting. So that means they're going to hold that pillow against the incision area while they do their treatments in order to help reduce pain. So once your patient's goal has been set based on those 3 factors, we're going to instruct them how to use it. So to use the incentive spirometer, looks like this. You're going to have your patient insert the mouthpiece into their mouth, and we've got their goal set, and they're going to take a nice slow deep breath in, as deep as they can, as slowly as they can, until they cannot breathe in anymore. And then they're going to hold their breath for 3 to 5 seconds and then slowly exhale. As they inhale, this white float down here will begin to rise and get close to their goal, and this float will also rise. And this one, if you can read it, we want to get it in between better and best. You're going to have your patient perform this about 5 to 10 times every hour. And when they're done, you're going to have them take a deep breath in and cough, which is going to help aid in the mobilization of secretions. And it's going to help get those lung volumes open, getting that deep breath into those or getting that air down into the alveoli. And so it's really important for your patient to remember to hold their breath after they breathe in when performing incentive spirometry.